Iran's handling of the coronavirus outbreak shrouded in secrecy. Let's start with that sweaty press conference late February. Addressing the nation, a government spokesman claims the number of reported COVID-19 cases in Iran are overblown, and that authorities aren't really in favour of quarantine measures. All the while, next to him, the country's health minister, Iraj Haruchi, is working up a sweat. He's wiping his forehead and looking increasingly worse for wear. At one point, an aide even has to bring him more tissues. The farcical nature of the press conference wasn't lost on the Iranian public, and neither was the irony. A day after that sweaty public address, Haruchi tests positive for the coronavirus. The health minister, now sick with the virus, then releases a video.
حتما ظرف چند هفته آینده در مقابله با این ویروس پیروز خواهیم شد. مطمئن باشید که ما کرونا رو شکست میدیم. مطمئن باشید، از ته قلب اینو میگم. مراقب خودتون باشید.
That kind of optimistic rhetoric has been echoed by Iran's supreme leader Ayatollah Ali Khamenei.
البته من نمیخوام مسئله رو خیلی کوچک بگیرم، اما خیلی هم بزرگش نکنیم مسئله رو. یه قضیه ایست پیش آمده، یک مدتی که انشالله خیلی طولانی نخواهد بود. این برای کشور وجود خواهد داشت. بعدم
But Iran has among the most deaths outside of China. Dozens of officials have been infected. A senior advisor to the supreme leader has died. So why hasn't the leadership reflected that grim reality? There have been a flood of reports that claim authorities are lying about the full extent of the problem. And much of the criticism is coming from medical workers on the front line. Citing hospital sources, the New York Times reported that nurses were being intimidated into keeping quiet on the grounds of national security. A video surfaced on Twitter that was reportedly filmed at a hospital in Qom, the centre of Iran's coronavirus outbreak. The gruesome footage appears to show body bags lined up across tables and floors. According to local news reports, the person who shot that video has now been arrested. In a bid to minimise the spread of the disease in Iranian prisons, authorities temporarily freed 54,000 prisoners who were deemed symptom-free. But there was no clear sign that all the inmates had been tested, especially as the country faced a shortage of testing kits. The World Health Organization Director General Tedros Adhanom said there's no evidence pointing to a cover-up, but some lawmakers have cried foul.
One of them is a lawmaker from Qom. Ahmed Amirabadi Farahani tweeted this claim.
The doctors at Kamkar and Foghani hospitals are writing that the cause of death is respiratory failure, but they know very well that the deaths are happening in the coronavirus quarantine ward.
Gholam Ali Jafar Zadeh Iman Abadi, a politician from Gilan province, has made similar claims. He said you only need to look at the reports from cemeteries to see the death toll is higher than reported. And in an interview with local media, he called official figures a joke. It is true that Iran is dealing with crippling sanctions, and this is hampering efforts on the ground to get hold of equipment, including testing kits and Hamzat suits. Iran accuses the West of trying to weaken it.
Unfortunately, those who even impose drugs and food sanctions on people have done the most vicious act against the Iranian people in these 2 years. They've appeared with a mask of sympathy that we also want to help the people of Iran. If you're telling the truth, then lift the sanctions from medicine.
Still, there's a sense that Tehran has been too slow to act, and that efforts have been focused on controlling the information instead of bringing the contagion itself under control.